enough. Okay. So we've talked about 2 of the cranial nerves so far. There are 12 total. I guess we can talk about 3-ish. Just a quick recap. Olfactory nerves. There are those bunny ear things. Really, they're ending here. The bunny ears are the tracts. Olfactory bulb and olfactory tract, but this is where olfactory nerve leads into. It's not the secret smell. It's the only one that doesn't come off of the brain stem. Olfactory nerves. Then it goes through the olfactory foramen of the ectoid. Cranial nerve 2 is optic. And the optic nerves cross over at the optic chiasm. So you get both contralateral processing and ipsilateral processing. Because we'll see that there are tracts that go all the way across and then the same side. Contralateral and ipsilateral.
So the top part that you're below X, would that be like the front of the face?
Yeah. So where is this located? This is anterior rostral.
Okay.
Yeah. And then here's the brainstem, so this is column.
Okay.
And we're looking at the underside of the brain. Right, so cranial nerve 2 is optic. Both olfactory and optic nerves are sensory nerves. Our pathway starts somewhere outside, like in the eyes or whatever, and goes into the brain. We left off on cranial nerve 3, which is off around here somewhere. The oculomotor nerves, this is our first motor nerve. And it moves 4 of the 6 muscles for eye movement. So in this diagram here, this eye right here, this is medial, so this is nasal, this is lateral. So this muscle is called the medial rectus. This is the lateral rectus. It does not control the lateral, it does control the medial rectus. So if the medial rectus contracts, which way will your eye turn? If you have a muscle right here that gets shorter, it's going to go towards your nose. It's going to adduct. Your eye will adduct, it will move inwards. It also controls the superior rectus and the inferior rectus, so moving your eye up, moving your eye down. It also controls the inferior oblique. You can see how it's kind of going sideways and attaches to the side here. So when it contracts, it rotates your eye, like rolling outwards, or either way.
I was gonna ask, like people who can either like cross their eyes forward or like go in different directions, is that more of like a muscle thing or a nerve?
Yeah, that's a great question. People who can cross their eyes or do something weird with their eyes, is that a muscle or a nerve thing? I mean, I guess it's both. It's just for whatever reason, people have better, like well-developed, good control of those muscles.
Okay.
Don't know too much more about that, but yeah. But that's what you'd be controlling. You control those muscles. Or if you have a lazy eye, maybe the nerve connection or muscle's weaker or something. So it controls 4 muscles. It does not control the superior oblique. It does not control the lateral rectus. We'll get to those next. It also controls the muscle, this muscle here. It also controls the muscle of the upper eyelid, the levator palpebrae superioris. It lifts the upper eyelid, levator palpebrae superioris. It also controls muscles that are called ciliary muscles. These are smooth muscles that control the size of your pupil. Control your lens. This is the one that controls the pupil. Ciliary muscles control the size of your lens, so you can focus on things. That's what accommodation means, focusing on things. And then to control the size of your pupil, that's your sphincter pupillae. The sphincter muscle, it's round, smooth muscle. So oculomotor, important for moving your eye, focusing on things, changing the amount of light that gets into your eye, and even opening your eyelid. A lot of different important things regarding your eye. Midbrain is somewhat relevant here because the midbrain does a lot of different things, including controlling things about your vision. In general, what the midbrain is important for is for maintaining consciousness and alertness. It's being awake, being alert and conscious. That's something very basic, something that, basic survival. That's controlled generally in the midbrain. One special thing that the midbrain can do, the superior colliculi specifically, not the inferior, the superior colliculi are important for visual startle reflex. So if you see like a flash of lightning or something just flashes out at you and you just kind of jump, that's controlled by the superior colliculus. We'll get to the inferior colliculus in a minute. But superior colliculus for visual startle. Okay. So the oculomotor was just for 4 of the muscles. The trochlear is for 1 of the muscles of moving the eye. We've seen this word before, trochlea. Does anyone remember where we saw this? It's around the elbow, which bone? Yeah, the humerus. The humerus had a trochlea, a bone feature called the trochlea. It's pulley-like. It's a round pulley-like thing. Trochlea, trochlear nerve is a nerve that controls the muscle, a muscle that fits inside of a pulley. The superior rectus, this muscle on top here, its tendon, it loops around this hook. The hook is called a trochlea. It's like a pulley. And here's a lateral view. Here's the muscle. Here's the superior oblique. It goes through this trochlea and then goes to the side here. It's called the trochlear nerve because it controls the superior oblique, which goes through a pulley-like system, the trochlea. And when it contracts, it makes your eye roll. When this contracts, it's going to turn your eye like inward, like rolling inwards, rolling towards your nose. So because it only controls 1 muscle, is it this one that's the smallest? I believe it's the smallest. Yeah, the smallest. It's only controlling 1 small muscle. It's the smallest nerve. It comes a little bit lateral, a little bit more lateral of oculomotor. Coming near the inferior colliculus. What else? Oh, the hole that it goes through is the superior orbital fissure, the big hole in the back of your eye, back of your orbits through the sphenoid. Superior orbital fissure. So its one job is to control eye movement, rolling your eye inward towards your nose. Take a moment. Lesion means damage. That first word, lesion means damage. Please, your pen and give you more time. Okay. So your answers, answer 3. 1, 2, 3. up, please? Cool. On three, say the letter. 1, 2, 3. C. C. Here's why. If you lesion a nerve controlling muscles, that means you can't control that muscle anymore. We saw that oculomotor controlled a bunch of muscles, including inferior oblique, medial rectus, inferior rectus. So in other words, you can't turn your eye out, or you can't turn your eye in, you can't turn your eye up. But your trochlear nerve, if this one still works, that means you can still turn your eye up and in. So if it's veering that way, if it's favoring this muscle activation versus others, it's that you've damaged oculomotor, not trochlear. Cool? What's another question? Raise your hand a few more times. All right, answers on 3. 1, 2, 3. Find someone with a different answer. We've kind of clustered, so maybe yell across the room. Go ahead, what do you like?
Which one is, okay, 2 is optic. Oh, because the retina is like the origin of it. Wait, oh yeah. It shows up on the slide for optic nerve, it doesn't like say anything about like how it works. Maybe I just it says, in optic nerves, yeah, so that means basically anything that allows you to see will cause damage. That would be the
All right.
And
One.
being able to project your.
One more time, please. Let's see your hands.
It's shown that's.
1, 2, 3.
Okay, that would make sense.
Interesting. All right, hands down. So, olfactory and optic, what do they have in common? Those are sensory nerves. That's what they have in common. Both olfactory and optic are sensory nerves. Oculomotor and trochlear are both motor. They control things. We're looking at an inability to constrict pupils and an inability to blink. To constrict pupils, you need muscle. To blink, you need muscles. Are we looking for a motor nerve or a sensory nerve? Motor. It's oculomotor, C. It's not that you can't see the light, it's that you can't respond to the light. It's controlled muscles. So really, if there's a problem with your optic nerve, what would the symptom be? Loss of vision of some kind, blind or like even blind spots. Some effect of your ability to sense things like perceived vision. Right. Oculomotor controls eyelids, oculomotor controls pupils. Oculomotor controls focusing. All right, that's 4. Next one, trigeminal. Hopefully you remember this one because it's the largest nerve, it's just lateral of the pons. You can see it on the cadaver brain. Trigeminal, it's called trigeminal because it has 3 branches. You should know the branches. They're the ophthalmic, there's a PH, ophthalmic. PHPH. Ophthalmic division, maxillary division, mandibular division. 2 of those words should sound familiar, maybe even 3 if you go to the eye doctor a lot. Ophthalmic is towards the eye region, maxillary, middle, upper jaw, mandibular, lower jaw. 3 major branches, those 3 parts of your face. Okay. Coming off here. All right, so we have 3 branches, so let's go over those 3 branches. Before we do, I said that it's coming off of the pons. These trigeminal nerves, the trigeminal nerves are coming off the pons. What is the pons for? For many different sensory pathways, the pons is a relay station. So for example, what's not shown here, when we see things, so you see something, it gets to the thalamus, and then it goes to the occipital lobe, goes to the optic visual cortex. Remember the lateral geniculate nucleus? That's in the thalamus. When you sense things like in your hand, it goes up through your brainstem, stops to the thalamus, and then goes to your somatosensory cortex. When you control things even, it goes to the thalamus and then goes somewhere else. It's often a relay station for sensory and motor pathways. It also has clusters of cell bodies. It also has nuclei that control breathing. So you don't have to think about breathing. It's voluntary control. So a very basic, important area. Definitely don't want this damaged. Base of your brain. And the trigeminal nerve is just lateral of it. So, let's talk more about the trigeminal nerve. 3 branches. The first branch is the ophthalmic. Ophthalmic is referring to the eye area. Ophthalmic. It is a sensory branch. So what's shaded here in blue, lighter blue, this is the region where we sense things along the trigeminal nerve. So you're sensing things from your orbital structures, from your eye, from your nasal cavity, from the nose, forehead, upper eyelid. Like the previous nerve, like trochlear nerve, it also goes through the superior orbital fissure. The fissure is a large hole. It's a large crack-like hole. So it fits several nerves, blood vessels. And it goes to the pons. Yes?
So what is CNP1?
Cranial nerve, first branch of the 5th cranial nerve. Yes?
Does it have another name?
Does it have another name? Not to my knowledge. Ophthalmic branch of the trigeminal nerve. Do you have another name?
For 6?
This isn't 6. This is 5, branch 1. Another reflex that this is important for, if you touch your cornea, I don't recommend doing it, not fun. You like touch your eye, you blink. That makes sense. That's mediated by this nerve, by the ophthalmic branch. You touch your cornea and then you blink in response to that. Let's say a fly gets in your eye, you blink because it's bothering you. Yeah.
Is that like putting in contact?
Like putting in contacts, yeah. If you put it in contacts, it doesn't sound fun to me, but you're trying to override that reflex. With practice, you can override reflexes. You know, to an extent. All right, that's the ophthalmic branch. The maxillary branch, cranial nerve 5, branch 2, is also sensory, but it's more from the middle of your face, which makes sense. It's called maxillary, or maxilla is the middle of your face. So what's shaded here in this yellowish orange, that's a whole region for maxillary. So your lower eyelid, your cheek, your upper lip, gums, teeth, your hard palate, your top palate area. This goes through a different hole. This goes through what's called foramen rotundum. We'll see it in lab. We haven't gone over this hole yet. It's called foramen rotundum. It's a rotund, large round hole. Also goes to the pons. Let's say you're getting work done in your teeth, like you've got to get a crown or something, and so they give you Novocaine injection for your upper teeth. They would be injecting in a branch of this nerve to numb it so you don't feel any pain as it would work. So despite ophthalmic and maxillary being both in the trigeminal, collectively the trigeminal nerves, they go through different holes. The previous one went through superior orbital fissure. This one goes through foramen rotundum. Third branch, the mandibular division. So this is for your lower jaw. But no, this is also for sensory. It senses your gums, your teeth, and your lips. So again, you can do a nerve block here if you're getting work done for your lower teeth. But it's also for controlling chewing. So here's our first mixed nerve. It has both sensory axons and motor axons. This is a mixed. Mandibular is a mixed nerve. It's both for sensory and motor. Sensory because we're sensing things from our lower jaw. Motor because it's controlling the muscles of mastication. You should know what they are. What are they? You name one. Masseter, temporalis, and then the one that sounds fun. Pterygoid, medial lateral. So it controls all those muscles as well. It goes through a different hole. So each branch goes through a different hole. It goes through foramen ovale. Ovale. Pronounce it E. It's an oval-shaped hole. They're all rounded up and roll. I don't know what it means. Foramen ovale. 3 different branches, 3 different functions. This is our first mixed nerve. Has both sensory and motor aspects.
So the whole nerve is considered mixed because the mandibular.
Yeah. So when we talk about the trigeminal nerve as a whole, because it has both sensory and motor components, it's collectively known as a mixed nerve. Yes. Sensory, and motor. But we would say trigeminal is a mixed nerve because it has both sensory and motor functions.
Can you say
Which ones?
which ones were sensory and motor?
Yeah, which one's sensory, which one's motor? Sensory, motor, mixed. But specifically sensory, mixed. All right, that was all trigeminal. Next one is the abducens. This is our last one that controls the eye. Cranial nerve 6 is abducens. What does it mean to abduct? Go outwards. I'm abducting my arm right now, right? Abduct my arm. If you abduct your eyes, they go laterally. So it controls the lateral rectus. Yeah, look to the left. At both the same time, certain people can. But you can at least do one at a time. If you look to the left or look to the right, you're controlling. Abducens. You're abducting your eye. Controls the lateral rectus. This also goes through the superior orbital fissure. This is the third nerve now. It goes through that same hole. Starts at the pons at the junction with the medulla, so it's like down here. Controls the lateral rectus. Okay. Our seventh one is facial. Facial nerve comes off of the pons, also near the medulla. A bit more lateral. I don't know how to draw that in. Sorry? It's also mixed. Facial is also mixed. Abducens is just motor. Facial is a mixed nerve. When we looked at trigeminal sensed most of your face. Facial does have a sensory aspect, but it's more for taste. Facial is mostly motor. It's for taste and motor control of the face. So all those facial muscles for facial expression that we discussed, facial nerve. Seven. It does have several branches. I'm not going to test you on them, but in case you care to know, you can have this little facial mnemonic, temporal, zygomatic, buccal, mandibular, and cervical. Controls all those parts of your face and your neck. Yeah, all these nerves have branches. Well, not all of them, but like just trigeminal branches. These I do want you to know for sure for the test. You don't need to know the branches for facial. Just it's going all across the face. Though. There's branches here, 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 here. The hole that it goes through is the internal acoustic meatus, or you can call it auditory canal. It's the same thing. We have an external acoustic meatus, outer ear canal for hearing. We have an internal one for nerves to pass through. We'll see this again in a minute. So again, it is for taste for most of your tongue, the anterior 2/3 of your tongue, but it's mostly for control of things in your face. Facial muscles, salivary glands, tear ducts, lacrimal glands. You will need to know muscles for the upcoming practical. Muscles as innervated by nerves. Is it closed? Good? Facial's another mixed nerve, yeah.
I know we're not going to do tests on them, but the pinky where it's pointing to the temple is pointing to like this, right?
It's like forehead, temporal area, yeah.
Okay.
That's what that's pointing to. Pretty much your whole face, like from here all the way down to your neck. Yes.
Did you say that this one was mixed?
This is a mixed nerve, yes. Facial is a mixed nerve. You're sensing taste, and you're controlling facial muscles, salivary glands, lacrimal glands. What kind of secretion are salivary and lacrimal glands? What kind of secretions are salivary and lacrimal? Not sebaceous. I think I heard it. It's not evident. Not Hall. It's eccrine. It's eccrine. All right. The eighth cranial nerve is the vestibulocochlear. Vestibulocochlear, cranial nerve number 8. And it has two branches, which you should know. It has a vestibular branch, and it has a cochlear branch. That's vestibulocochlear. This starts in the inner ear, yes. We have something called the vestibular apparatus. We're going to learn that this is for our vestibular sense. It's for our sense of balance. It's for our sense of balance. If you feel particularly dizzy or have vertigo, something's usually affected in this area, in your vestibular apparatus. You can see the vestibular apparatus right here with these big loops and this base right here. This is a vestibular apparatus. Your ear, this is showing the right side. Your outer ear would be here, ear canal, eardrum. Remember these? Malleus incus stapes. And then here's the cochlea. So the cochlea is a snail-shaped thing. And then the vestibular apparatus is up here. Here's the vestibular branch. Here's the cochlear branch. The cochlear branch is for hearing. The cochlea is our organ of hearing. Vestibular branch is for balance. They both synapse, these branches will go to the medulla. You can see it going to the medulla here. There are nuclei in the medulla. There's a vestibular nucleus in the medulla, there's a cochlear nucleus. There's things like hearing, sense of balance, or basic functions. Yes? Which one causes vertigo? If you have an affected vestibular branch. Vestibular is a sense of balance. They're both sensory. They're both sensory. Sensing sense of balance, sensing hearing. Vestibulocochlear. The whole nerve is called the vestibulocochlear because they branch together. But their branches are called vestibular nerve and cochlear. Two of them are vestibulocochlear. They're both sensory. Both sensory. Sensory. It also goes through that internal acoustic meatus, just like the facial nerve. It also goes this right here. Here's the external acoustic meatus, your outer ear canal. Here's the internal acoustic meatus, this hole for the nerves to go through. We can see it at the base of the skull. This is something you will look at in lab. We've been mentioning the medulla a bit here, so let's look at it a bit more closely. It's very important for very basic autonomic things you don't have to think about. It's continuous with the spinal cord, so it's going to have lots of connections with the spinal cord, lots of projecting fibers. Remember those medullary pyramids? On either side of this midline, you've got these bumps that run all the way up and down. Those are the medullary pyramids for projection fibers, ascending and descending tracts. Those nuclei that I mentioned, you can find several different nuclei in those lateral bulges. Those are the olives. Yeah, the olives. You can find nuclei inside of the olives. Basal nuclei is in the cerebrum, not the brain stem. It's important for things like regulating heart rate, regulating digestion, regulating blood pressure, and most of the cranial nerves are attached to it. So from here and on, they all mostly associate with the medulla. Okay. Just to look at the branches individually. Here's that vestibular apparatus. Here's the vestibular branch of the vestibulocochlear nerve. Our sense of balance gets processed in several areas. It can go to the vestibular nuclei of the medulla. It can also go to the cerebellum. Remember, our cerebellum is really important for balance. So that information can get sent to the cerebellum. After getting sent to the medulla, it can then pass to the thalamus. Remember, the thalamus is an important relay station for most of our senses. And then from the thalamus, it can get processed in our cerebral cortex. So there are automatic things that our brain can do. Our cerebellum is unconscious. We don't have to think about using our cerebellum. So just maintaining balance, that's processed there. But if we want to think about our balance, if we want to process that more deeply, we can send information to the cerebral cortex.
What do you mean about
I can think about balancing. Just me thinking about my sense of balance, that's getting processed in the cortex. Anything higher order, anything really complex, it's going to be processed in the cortex. If it's automatic, it's going to be processed lower down here.
Does it? Never mind. I can see it.
When we hear things, obviously we can know that we're hearing things. So when we hear things, like say from our cochlea, it'll get sent to the medulla first, then to the thalamus, and then to the auditory cortex in the temporal lobes. So this is what we traditionally think is processing hearing, from the cochlea to the medulla, to the thalamus, to the auditory cortex. The specific part of the thalamus that it goes to is the medial genicular nucleus. For vision, it was the lateral genicular nucleus. For hearing, it's the medial genicular nucleus of the thalamus. But when we hear things, it's not just for knowing what sound is playing. We can also use hearing as a way to balance. It's like kind of like echolocation, not as well developed as say bats, but we can use sound to know how balanced we are. So from the medulla, we can also send information to the cerebellum. Neurons can go from the medulla to the cerebellum instead. We can also have a stopover in the midbrain. We talked about how the midbrain is important, like the superior colliculus is important for a visual startle reflex. The midbrain is also important for an auditory startle reflex. That's what the inferior colliculus is good for. So if you hear a loud noise, it kind of makes you jump. That's the auditory startle reflex.
When you were talking about the creative range on the last slide, you said we use sound to know how we're balanced. Does it travel a different path?
Yeah, does it travel a different path to use sound to know how we balance? It does. So to process general hearing, like know that I heard a sound, to know that I hear you talking, it goes from the cochlea to the medulla, to the thalamus, to the auditory cortex. That's for processing general sounds. For balance, it would go from the cochlea to the medulla to the cerebellum.
So it like stops at the cerebellum and ends there, or does it then continue
Does
on?
it stop at the cerebellum? I mean, the cerebellum has tons of connections going in and out of the cerebrum, so
Okay.
it would probably do further stuff.
Okay.
You're using that information to decide what to do with it. But at least for processing the sound, that's where it will get processed.
So is it the same process, so if you put in headphones, is it the same thing? It's the same process for hearing?
What do you mean?
Like putting headphones and playing music, is that?
Yeah. If you're listening to music, what you're hearing the sound and you know that you're hearing sound, it's going from the cochlea to the medulla to the thalamus to the auditory cortex. That's for general processing of sounds. For balance, it would go to the cerebellum. For startle reflex, it would go to the inferior colliculus.
So when you have an ear infection and your sense of balance is messed up, where exactly would that like be interpreted?
If you have an ear infection and your sense of balance is messed up, it's probably pushing on this nerve or something, or affecting the pressure within this thing. We're going to talk about this probably next week, this vestibular apparatus. Yeah, it's messing something up somewhere along here. Any questions? All right. Cool, take a moment. Raise your hand if you need a touch. 3 seconds. All right. See your hands on 3. 1, 2, 3. Cool. Find someone with a different answer. Go ahead, 1 minute. What do you think it was? Which nerve is needed for taste? Discussed so far. It does have multiple functions. The trigeminal is sensory, like just like touch and pain and temperature. I guess which one doesn't go? Which nerve doesn't go through the internal meninges? That's really the question. Which nerve doesn't go through? Several nerves. Okay, one more time, please. To your hands. 1, 2, 3. Not the majority yet. Okay. So the real question is, which nerve does not go through the internal crus meatus? We just saw vestibular cochlear nerves, both vestibular and cochlear branches, they go through the internal crus meatus. So your sense of balance would be affected. Your hearing could be affected. We also saw the facial nerve also goes through the internal crus meatus. And the facial nerve is important for taste, and it's important for control your facial muscles. So your face would droop, and you could have affected taste. Painful and sensitive lips. What nerve would that be? It's trigeminal. Trigeminal goes through, well, if you're talking about lips, it would either be foramen ovale or foramen rotunda. So, yeah, trigeminal nerve, painful sensitive lips, that would not be a symptom. That would not be a symptom that could damage the internal crus meatus. It's B, easy boy. Drooping of the face, it's facial nerve, change in taste, facial nerve, loss of balance, vestibular cochlear. So all those would be affected, not trigeminal, not pain and sensitivity of the face. Does that make sense? Applications? There's another question. Raise your hand a few more time. Hands on 3. 1, 2, 3. Talk it over. Find some different answer if possible. Talk it over. 1 minute.
Yeah, we did.
Yeah, this
I
is
don't
like,
think it's on any of those like sounds.
too much, too much. There's no fire too. There's no fire to do it. All right. One more time, please. Hands on 3. 1, 2, 3. 3 to the letter. 1, 2, 3. Right. Inferior colliculus. That's for the auditory. We're looking for an auditory startle reflex. If there were flashing lights, that'd be visual. That'd be superior. Medial geniculate nucleus is important for normal auditory or visual processing. This is for auditory processing, like going to the auditory cortex. Lateral geniculate nucleus is a stopover to the visual cortex. But for this specific reflex, it's the inferior colliculus. All right, 2/3 through the cranial question.
Are the medial and lateral geniculate, did we learn, is that in the slide?
It's in the slides, it is. Medial geniculate nucleus, whoops.
What slide was it?
I can't. Medial geniculate nucleus is a stopover, also for vestibular sense, and then for lateral geniculate nucleus, you go to the optic one. Mentions it. Okay, we are at number 9. Cranial nerve 9, which is IX in Roman numerals, is the glossopharyngeal. Glosso, that root word glosso is referring to the tongue. Glosso means tongue. So glossopharyngeal is referring to the tongue and throat. So for sensing tongue, also for taste, this time it's the posterior third, not the anterior 2/3 like facial. And also for swallowing. So which bone will be moved a lot? The hyoid. Muscles attached to the hyoid. So this is a mixed nerve, the glossopharyngeal. This is its destination. It's coming around the medulla, just lateral of the olives. Lateral of the medulla, lateral to the olives. The hole that it goes through is the jugular foramen. It's the same hole that for the jugular vein, which will come up later, and as well as a few other nerves. It's an important hole. Jugular foramen. The sensory part, again, is for taste for the back of the tongue. Posterior third. Touch and taste of the tongue. What are we controlling with motor? We're controlling the parotid salivary gland. For now, just know it's the salivary gland. We'll go over the specific salivary glands later. But it's a salivary gland that's it's like back here by the base of your jaw, where the ramus is. It controls the salivary gland and it controls muscles of swallowing. So it's controlling muscles that are attached to the hyoid or thyroid cartilage. Yes.
Do you want us to know all of those muscle names?
Of
The ones that are attached to the hyoid?
the ones that attach to the hyoid, you need to know those names. We didn't go over them before, so I'm not gonna ask you to go over them now. I do want you to know they're attached to the hyoid.
Yeah, but we don't need to know.
Don't need to know the names, like, you got fun names though. Stylohyoid, mylohyoid. Okay, that's number 9, glossopharyngeal, it's a mixed nerve. Number 10 is super important, it's gonna come up a lot later. This is the vagus nerve. Vagus. Not Vegas like Las Vegas. V-A-G-U-S. Vagus. This is our longest cranial nerve. It starts at the base of the medulla, like down here. It can go all the way down to your heart, lungs, and digestive tract. That long. It's a very long nerve. It is a mixed nerve. It's both sensory and motor. In terms of sensory, types of things that we're sensing, say we want to regulate blood pressure. To regulate blood pressure, we have special baroreceptors, pressure receptors in our blood vessels. We'll get to those later. It's found in your aorta and your carotid artery, the artery that goes to your head. You want to know how much blood is going to our body and to our head. So we can sense that and send that information to our medulla, because remember, our medulla is important for heart rate and blood pressure. So if you want to regulate heart rate, blood pressure, we need to know what our heart rate, blood pressure are. So that's the sensory part. Also, we can sense, like, is there anything in our stomach? There's sensory receptors in our stomach that detect stretch, and that sends information to our medulla. Things like that. Basic things we don't have to think about. How inflated our lungs are, heart rate, blood pressure, the state of our digestive tract. In terms of motor, it's controlling also muscles of the pharynx, like glossopharyngeal, muscles in the larynx, so that you can speak, controlling your breathing, controlling your heart, controlling your digestion. So it senses from those areas and it controls those areas. A very important nerve with basic functions. It also goes through the jugular foramen. We saw how glossopharyngeal goes through jugular, so does vagus. Important for a ton of different things. Yes?
For sensory, you said blood pressure, heart rate, and
For sensory, blood pressure, heart rate, whether or not there's stuff in your stomach, your digestive tract, if your lungs are inflated. Yes.
I forgot somatic. Does that mean
Oh.
it's like voluntary?
Yeah, somatic motor versus visceral motor. What do I mean by that? I didn't introduce visceral motor. So somatic motor, that's controlling skeletal muscle. Somatic motor neurons control skeletal muscle. So voluntary for the most part. Visceral, this is muscle lining organs, which is typically what kind of muscle? Smooth muscle. So this is usually something I have to think about. Controlling your breathing, controlling your heart, controlling, I guess that'd be cardiac, and then controlling what's lining your digestive organs. So if you see the word visceral, it's lining some kind of organ. If you see somatic motor, that means skeletal muscle. Oh, we're going to learn what parasympathetic is. Maybe I mentioned it. It's like your rest and digest function. Your vagus nerve is essential for that, for controlling most, not all, but a lot of your rest and digest functions, like lowering your heart rate, lowering your blood pressure, reducing breathing rate, increasing digestion. That's all vagus nerve, through the vagus nerve. This is an added slide. This also shows up in the sensory slides, so if you don't have it, it's also in the sensory slides coming up. I just forgot to add that vagus nerve also has a very small role in taste. So altogether, the facial nerve, the glossopharyngeal, and the vagus nerve, they all are important for taste, gustation. Your gustatory cortex, it's in this part of your brain. What's this area called? This is the lateral sulcus right here. What's this region called? Preorbital lateral sulcus, it's hidden underneath. It's the insular cortex, thank you. Insular cortex. The gustatory cortex is found in the insular cortex. You can see it has a nucleus stop over the medulla. All of them go to that same nucleus. Yes? The gustatory cortex is found in the insular cortex. It's the wrinkly cortex that's hidden by more wrinkles. Here we are. That's 11. Almost there. This is the accessory nerve. You might hear it called the spinal accessory nerve. It's interesting that it's called spinal accessory because it kind of branches on both the medulla and spinal cord. So it's both a cranial and spinal nerve. Spinal accessory nerve. We'll just call it accessory. Number 11. It also goes through the jugular foramen. So these last three, glossopharyngeal, vagus, accessory, all go through the jugular foramen. It branches a lot off of the medulla and spinal cord. You see all these branches? It controls muscles of the soft palate, pharynx, and larynx, so also for swallowing, a little bit of speech. And it controls the sternocleidomastoid and trapezius muscles. Shrugging, moving your shoulders, your acromioclavicular joint, and moving your neck. So it is a motor. This is a motor nerve. Last one of the cranial nerves. Cranial nerve 12 is the hypoglossal. If someone has a way to not mix this up with glossopharyngeal, let me know. But glossopharyngeal is number 9. This is mostly sensory, some motor. Hypoglossal is motor. It's for controlling tongue movement. And it's actually found like in between. So here's here's accessory. Number 12 is a little bit higher up, a little more rostral. It's like right here. In between the in between the pyramids and olives. Hypoglossal controls the tongue, bless you. So its muscles, the muscles that it controls are also attached to the hyoid. The hyoid is important for tongue movement, for the muscles of tongue movement. It has its own hole, the hypoglossal canal. It's pretty close to foramen magnum, you'll see. These small holes are kind of close to foramen magnum. Yeah? Both. Both tongue. Yes? Vagus is both sensory and motor.
And then what about accessory?
Accessory was motor, controlling muscles of the soft palate, the neck muscles, and hypoglossal is also motor. Obviously, there's a lot of information here, so We're gonna need some mnemonics to help us remember all these different nerves. Here are some mnemonics. If you just want to remember the names in order, here's a clean version. Turn into a dirty one if you like. You've got 3 O's, so ooh, ooh, ooh. You touch and feel very good. What did they say, velvet? Yeah, such heaven. That's one mnemonic you can use to get the order correctly. If you want to know if it's sensory, motor, or both, here's one. Also a clean version for sensory, motor, and both. So those are 2 mnemonics, one for getting the order correct, one for getting their sensory, motor, or both. Again, feel free to modify it for yourself if you want to memorize it better. Here's one that I found the other day. If this helps you, it kind of shows what the nerves are doing. It's like this whole rhyming thing. Like C1 nose, C2 eyes, C3 pupils, C4 directions. If that helps you, sure. This has been updated, so this is online now. And then I really like Lenny Riggs's drawing because it shows you where they are, because you will need to know where they are. There's also this cranial nerve dude. It shows you where the cranial nerves are, like by using the numbers. So 1 is here, 2 are the eyes, it's vision. 3, 4, and 6 are from moving your eye, so you're putting it around the eye. 5 is your whole feeling from your face, but it's called trigeminal. 7 is hidden here. There's 7. 8, hearing and vestibular. 9 is glossopharyngeal. Where's 10? Oh yeah, 10 because vagus is going all the way down. 11 on either side. Oh, 12 is tongue, yeah. Sorry, 1 second. Got 2 minutes to answer Jim's question. It'll be important.
Did you update slides 10 and 9?
Did I update slides 10 and 9? I did. Right, this is updated.
Yeah.
This is updated. And yeah, whatever was for optic nerve, I updated that. Take a minute. Try to figure out which nerves you're testing with these tests. Might be more than one nerve. Take a minute to try to figure out which nerves you're testing.